to identify who is doing what where. So as a result, this is just to assist everyone to sort of have an idea, come up with a database so that anyone looking to further their education in palliative care, they know exactly who's where doing what. So we'll look at the different institutions that are represented here. They will talk about where they are located, what they offer, what courses they offer, costs of the different courses, entry requirements, modes of delivery, any associated awards, is it diploma, degree, whatever, and yeah, any other information that will be helpful for prospective students of palliative care, current also, who might be interested in pursuing further studies in palliative care. So welcome to our panelists, and thank you for making the time. I think this is quite overdue. We are also glad we are waiting for Dr. Eve. Oh, Dr. Eve is now online. That's great. Welcome, Dr. Eve. So we are going to follow the order that's given on our agenda. I think most of us have seen the agenda, so we shall follow that order. And hopefully we will be done by the time that we scheduled to do those, started just a few minutes late. So maybe just to kick off the session, let's have introductions from our panelists. Our panelists, you can just go ahead and unmute yourself. It will be great if we can see your video as well, if you are able to, so that you can introduce yourself and your institution, and maybe the country where you are located would be great also, yes. Please go ahead. Do I need to call you out, or you can just introduce yourself? Can I call? Let me start with Elvis. You are the first on my screen. Elvis Mitty, please introduce yourself. Then Professor Krause, you introduce yourselves. Then Michelle.
Well, thank you. Thank you very much. Can you hear me?
Yes, loud and clear.
Yeah. Thank you very much. I'm Elvis Josmith. I'm in Tanzania, southern part of Tanzania, not very far from the border with Mozambique, about 170 kilometers. And I'm representing MUHAS, that is Muhimbili University of Health and Allied Sciences in Dar es Salaam, where we are providing a course on palliative care. I'm a social worker, and I have done also a master's in palliative medicine, but I have also done a BA in philosophy. A lot of things around. Thank you very much.
Thanks, Elvis. Welcome. And Professor Krause.
So firstly, thanks for today. I'm Dr. Renee Krause. I am from the University of Cape Town. I'm the acting HO head of division of the Division of Interdisciplinary Palliative Care and Medicine. I'm originally a family physician, but I've got my master's in palliative medicine, and I've been working in the field for nearly 18 years. So, and I will tell you everything that the University of Cape Town does. So thank you for having me here.
Great, welcome, Michelle. Then,
Hi, everybody.
Sorry, after Michelle, we'll have Duncan Kwaitana. Thanks.
Thanks, Petra. Hi, everybody. My name is Michelle Mehring. I'm a pediatrician by training, and I convene the postgraduate diploma at UCT in pediatric palliative care.
Thanks. Mr. Duncan?
Yes, thank you so much. My name is Duncan Kwaitana. So I am a lecturer, but also a course coordinator for the Bachelor of Science in Palliative Care at Kamuzu University of Health Sciences. Formerly, for those of you who know, it was called the College of Medicine. So I'm here in Blantyre, Malawi. Thank you.
Thank you. Next will be Dr. Hussein Elias. And then after that, Prof. Ikelo, Prof. Fajai.
Hi, hello everyone. Thank you so much for having me here, and thank you for organizing this fair. I mean, pretty excited about it. It's about time that we actually have something common for us in Africa. So I'm from Kenya, Eldoret, and I'm representing Moi Teaching and Referral College. That's the hospital college that's in Eldoret, and Moi University as well. And I'm here to talk about like the current programs that we have and the future like coming soon programs that we are planning to launch as well. Thank you. And by the way, I'm a family physician actually. I'm a consultant family physician and a lecturer at Moi University as well, and a course director for the higher diploma palliative care program at MTRH College. Thank you.
Thanks, Dr. Hussein. Welcome. Prof. Ajay.
Yeah, good afternoon, everyone. I want to thank the APCA, especially Eve, for organizing this education fair. I think just as it has been mentioned, this is long overdue. We need to develop training in our continent rather than going abroad to study, which is much, much expensive. I'm Professor Ikeoluwapo Ajayi, originally a family physician, but I'm also an epidemiologist, and I have certificate in palliative care, and I've been involved in palliative care training service since the early 2000. And currently I'm the director training and research for the Center for Palliative Care Nigeria, which is located at the University College Hospital, Ibadan. Ibadan is in the southwest of Nigeria. Thank you very much for inviting me. Thank you.
Thanks, Prof. Ajay. Welcome. Let's hear from David Kavuma, and then Dr. Eve, you introduce yourself also.
Thank you so much. I'm David Kavuma. I work with the Maldives Institute of Health Sciences. I'm a counseling psychologist and a public health specialist by profession, and I happen to coordinate the higher diploma in palliative care program at the Maldives Institute of Health Sciences, and I head different programs there. I'm happy to be part of this event. Thank you.
Thanks and welcome. Dr. Eve and Lacey, you can introduce yourselves.
Lacey, do you want to go first?
Thank you, Eve. My name is Lacey Ahern. I'm with Global Partners in Care. For those of you who do not know, we are an organization based in the United States, and we work very closely in partnership with APCA to support palliative care training programs on the continent and to offer some scholarships for students to study in Africa. And so that's all I have to say to this. Eve, I want to turn it over to you. We have a great group of panelists today. Thank you.
Thank you, Lacey. And hi, everyone. I'm Eve, and I work with the African Palliative Care Association, and I have an MSc and PhD in palliative care. Thank you. Back to you, Zerai.
Thanks, Eve. Maybe just before we move on to the next bit, let me just give Ethan a moment to introduce himself. Ethan, welcome.
Hello, thank you so much. My name is Ethan Hart, and I'm an intern with Global Partners in Care from the United States.
Okay, welcome. Maybe I can also just welcome the APCA team. Thank you for being online, and thank you to all the participants who are joining us from different parts of the continent and beyond. You are most welcome. I have outlined briefly that we are here to profile all the different institutions that are offering palliative care training in Africa. Part of it is to increase demand for those courses, increase awareness about palliative care training that's available on the continent, but also even Lacey just referred to a scholarship program that we have also to increase the uptake of those scholarships for palliative care. So without further ado, to all our participants, please, if you have any questions and contributions, let's use the Q&A platform. I have seen others are introducing themselves already there. Please use the Q&A platform for any questions to any of the presenters, as they shall be sharing on their different institutions, and the panelists will respond. It would be great if you can indicate which institution you are directing your question to, because, so that you can get the response from the right person. That would be also great. Now, let's move on to the actual program. I'm going to invite the first presenter, who is going to be Michelle. And then after Michelle, Renee, you'll follow. And then after that, we'll follow David from Mildmay. And let's do that in that order. You're welcome.
Sorry, Wetzerai, just a small
Yes,
comment.
Sure.
We have a presenter from Hospice Africa, Uganda, and then another one in Ghana. I just request admin to give them panelist login details.
Okay. Frank, will you be able to do that?
Yes, I will.
Thanks. Okay, great. Okay, so welcome to the first three presenters. Let's hand over to you, Michelle, Renee, and then David.
Fantastic, thank you so much. I'm just going to share some slides. All right, is everybody able to see?
Yes.
Right, thank you very much for this opportunity. So I will be presenting to you this afternoon on the postgraduate diploma in pediatric palliative care at the University of Cape Town. I'm going to start with a little bit of history, and this will also be a bit of overlap with Renee's presentation. I'll then just tell you a little bit about our staff and our lecturers. I'll give you a brief overview of the course, information on our fees and bursaries, and then also how to apply. All right, so starting off with the history. So our pediatric diploma actually started as part of the adult palliative medicine diploma at UCT. And this was started by Professor Liz Gwither in 2001 within the Department of Family Medicine at the university. The original diploma was actually a collaboration between UCT and Cardiff University. And our funding support came from the Diana, Princess of Wales Memorial Fund. So from 2001 to 2008, UCT allowed only doctors on the program. And then in 2009, the diploma was open to multidisciplinary professionals. So basically any postgraduate professional relevant to the practice of palliative care. We also started a pediatric elective in 2009. So in those days, there was a combined first semester, both adults and pediatrics. And then the class was split into two classes, adults and peds, from 2010 going forward. In 2017, the pediatric elective was moved over into the pediatric department. And from this year, we've been given permission to run a separate stream in pediatric palliative care in the pediatric department at the University of Cape Town. I currently am the course convener for the diploma, and I'm supported by Soraya Daniels, who is our administrator. We have ensured a multidisciplinary lecturing and marking team so that we actually do due justice to the different scope of practice of our various students. So we have Christelle Kleinhans, who's a social worker. Tracy Newpin is my other pediatrician. Teresa Jennings is our medical officer, and Tracy Rawlins is our palliative care trained nurse. So this is the team of lecturers and markers. And then we're also very privileged, especially during our contact weeks, to have guest lecturers. And Richard Bauer and Joan Marston join us from Bloemfontein and the USA respectively, and particularly focus on spiritual care and pediatric palliative care. And then various members of our PEDS-PAL NGO team actually also assist us in running the contact weeks. And we also invite colleagues from the Red Cross Children's Hospital in Cape Town to lecture during our contact weeks. Just to give you an overview of the diploma, it's a one-year diploma. I wrote in brackets really 11 months because we do start quite late in January and we end in November. And as mentioned before, it's a multidisciplinary audience. So doctors, nurses, psychosocial professionals, chaplains, anybody with an undergraduate degree relevant to palliative care. The diploma is distance-based using the Vula online learning platform at UCT. We use adult and practice-based learning techniques. So participants do need to be working in a field where they can actually have contact with palliative care patients and specifically children. It's accredited through the South African Qualifications Authority for 120 credits, which in South African terms is a National Qualifications Framework Level 8 qualification. And participants are awarded 30 CPD points at the end of the year. The palliative care diploma is also an entry requirement for an MPhil in palliative medicine, currently only available for adults, but we're busy processing one for pediatrics. So if diploma students do want to progress to do research, they may go on to do an MPhil in palliative medicine. So it's just an overview of our timetable for next year. So the course is divided, the diploma is divided into 2 semesters. During the first semester, which runs from January to June, we cover the basic principles of pediatric palliative care. And this is commenced with a contact week, which that we do online in January. And then the students are required to submit 4 assignments during the first semester. The second semester is called Pediatric Palliative Care. It's more the clinical aspects of palliative medicine, runs from June to November. Also started with a contact week, which in this case is a face-to-face contact week, where we like to do lots of simulation training and go into the wards. This is then also followed by 4 assignments. And then at the end of the year, we have an exam, which is also face-to-face. We have a communication skills exam, which the students have to show their skills in communication, and we actually hire actors to evaluate them. And then we also have a 3-hour written exam at the end of the year. Throughout the year, the students are encouraged to do practice-based learning. They'll often be asked to do little mini assignments, going back to the wards and engaging with patients and families. Through the online learning platform at UCT, there's weekly lessons and recommended reading. We have forum discussions on various topics every 2 weeks. And during the whole year, students are also encouraged to collect a portfolio of learning so that we have evidence that they actually are applying what they are learning into their workplace. Our curriculum obviously then consists of a written curriculum, which is all of our lessons. We have our assessed curriculum, which we assess through our forums, our assignments, our exam at the end of the year, and our continuous formative portfolio. And our taught curriculum, our face-to-face curriculum, is our 2 contact weeks, the one in January and June. But of course, then there's also the hidden curriculum. And those are the things that students learn from their own patients and also from fellow colleagues doing the diploma. So I've just put a few photographs up here so you can see what kind of things we get up to. And you can see our very enthusiastic classes on the left-hand side. We have moved our first contact week to online just to make it a little bit cheaper, because it is quite expensive to come down to Cape Town 3 times a year. So in January, we do it on Zoom, and in June, we do it face-to-face. In June, we have a lot of fun. We go into the simulation lab, we go into the hospital, we see patients, we do role plays. And then at the end of the year, in the top right-hand corner, we subject our students to online examinations. A lot of the students find this very, very transformative. We have a lot of debriefing that happens as people realize how they didn't do things properly from a palliative care perspective in the past. And I just put an example there in the middle of a slide of a portfolio written by a pediatric palliative care intensivist who really felt that this diploma helped her to move from being burnt out to reconnecting with her purpose in pediatrics. So the students have a very transformative experience. Unfortunately, one of the things about the UCT courses is that are quite expensive. Our course fees are 55,000 South African Rand, which is just over 3,000 American dollars for the year. If you come from a non-SADC country, unfortunately, you have to pay an international fee, which actually ends up being more than the course fees. We are very fortunate at the moment to have some bursaries available. Global Partners in Care, in collaboration with APCA, assist us with part bursaries for our social workers and nurses. And we also have a South African organization run by a bereaved mom called Footprints for Sam, who provides bursaries for South African nurses and social workers. At the moment, we don't have any bursary support for doctors. To apply, you need to apply online. And you also need to apply through a departmental application process where you email myself and our course administrator. You complete an application form for the diploma and also attach your CV. We're still open for applications up until the end of November, so we've still got a few days to accept new applications. Yeah, and then I just put in 2 brief slides quickly for other pediatric palliative care trainings that are happening in South Africa. So for those not able to afford a diploma or not wanting to do something quite so academic, we do have the Patch Academy, which is an online learning platform. Our courses, some of them are free, our Introduction to Palliative Care and Supporting Children with Grief in the Time of COVID is free courses, and the rest of the courses are really very affordable, ranging from 350 Rand per course upwards. So another option for people unable to participate in a UCT diploma. And then I'm sure Renee is probably also going to talk about this, but very excitingly, next year we're going to be having a palliative care conference in South Africa, which is a collaboration between Hospice Palliative Care Association, PALPRAC, and Patch South Africa, which is the South African Children's Palliative Care Network. And this conference is in April, 26th to the 29th of April next year. Thank you very much.
Thanks for keeping it beneath your time as well. That would be great if we can all do that and we can catch up with those few minutes that we lost. Prof. Renee, if you are just getting yourself ready, please, to take over. Yeah.
Can you see this show? Okay, so as Michelle said, she is in the division of pediatrics. At UCT, we have a full division of interdisciplinary palliative care and medicine. And Dr. Meyering has already discussed the postgraduate diploma with you. We also have the exact same course that is focusing on adult palliative care. And it is online blended learning. We bring the students to Cape Town twice a year, and the exams are online. And it's one of our core courses that really allows people who want to train distantly to really join us. And I must say the graduates from this diploma have become real leaders in palliative care across Africa. We also have a master's in palliative care, palliative medicine. This is an NQF level 9 program. It caters for people who want to become leaders in the field. It requires both research, advanced palliative care skills, advanced ethics, and a lot of advocacy. So if you're really thinking of palliative care and this is going to be your career, we really recommend that you do your master's in palliative medicine. We have a lot of other courses. Firstly, we have a certificate in palliative care nursing. This we do with the Hospice Palliative Care Association of South Africa. It used to be in our division, but we have moved it over to the division of nursing. And watch this space, because soon we will have a postgraduate diploma in palliative care nursing. This is also distance learning, but it does require contact sessions. And you can see the person to contact is Leonore Haley. We also have a short course in palliative care. This is a 40-hour course. This is completely online. It is open to a wide variety of healthcare professionals. I just want to say the master's and the diploma are both open to social worker, anybody with a bachelor's appropriate to palliative care. So social work, nursing, medicine, psychology, etc. are all welcome to come and do the postgraduate diploma. And the short course in palliative care is also, it's open to a wide variety of disciplines, and it is completely online and very nice if you can't travel, and it is affordable as well. We have developed sort of bespoke curriculums. Firstly, we have a bespoke curriculum for palliative care for oncologists in Africa. This is an integrated program within the oncology registrar curriculum. We are very keen to extend this across Africa and to ensure we develop local facilitators across the continent who can train on this program with the already developed curriculum. This is assessed in the college exams. So all oncologists in South Africa do need to qualify with some palliative care training as an outcome in their college exams. We also have an undergraduate medical curriculum that is a spiral curriculum across the 6 years of medicine. And they rotate through various clinical areas from tertiary centers, community clinics, the pediatric field, emergency centers. And we have just published an actual paper on these outcomes and competencies that we feel all doctors should have when they graduate from medical school. And I really want to ask you to go and read this article so that you can also integrate palliative care in your undergraduate curriculums as well. Finally, we have another integrated program. We are training within the family medicine registrar program. This is a 6-week clinical rotation with students defining their self-related learning needs, and we consult with them about their outcomes, what they want to achieve. We have an online platform that they can visit with resources on it, but this is clinical teaching, and you can see behind me is one of the registrars and the team at Groote Schuur Hospital where they are training, and hopefully within the next few years we'll be able to train them more in district hospitals and in CHCs, community healthcare centers, so that all family medicine registrars are actually trained in palliative care. And palliative care is now one of the, is asked in the final college exams as well. Thank you very much. And thank you. I see there's a hand up. Are there questions? I see there's a question from Nabe and from Irene.
Dr. Eve, can a member of the APCA team take the questions? I don't have controls to do this. I don't see whether she dropped off maybe.
So Anastasia, do you want to perhaps post your question? Perhaps we should go on to our next presentation. I think it was Elvis. I don't know who the next presenter is.
Elvis, if you're ready, why don't we move on to you?
David, isn't it
Okay.
David?
Is David still
David?
on?
I think it's Mr. Duncan, according to the schedule,
Duncan, you want to present?
or it's Mr. David.
It's okay.
Let's go. David, are you there? David Kavuma,
Yes, I'm there.
please go ahead.
David, we can't hear you.
Oh, I'm sorry. I didn't unmute it.
Yes, yes.
Sorry.
That's much better. Thank
Okay. I'm David Kavuma. As I said earlier, that I work with the Maritime Institute of Health Sciences, and the Maritime Institute of Health Sciences is part of Maritime Uganda. Maritime Uganda is found in Wakiso, but only 10 kilometers away from Kampala. And the Maritime Institute of Health Sciences happen to run basically health-related programs, and the higher diploma in medical care for children is one of those programs. This Institute of Health Sciences Maritime was set up to run different programs in 2009, and they were formally allowed by Uganda's National Council for Higher Education. And we are having 4-degree programs that happen to run in partnership with the University of Manchester and the University in Mukono and the universities, and also happen to run even diploma programs as well as 5 certificate courses. And we are having about 1,200 students currently, and they are working hard to get to the degree awarding institution. Maritime Institute of Health Sciences has been running this program for quite some years, and because of the high need for palliative care for children, both in Uganda and Africa. This program started in 2014, and at first it was being supported by the Princess Diana Fund, and this helped us to start the work on the curriculum of the program. And they did some sponsorship for the first few students, but now it is basically sponsored. People have to pay their own fees. And we have trained the number of students, some from Uganda, others from Cameroon, and others from South Sudan. And because we are running other programs, of course, we are trying to leverage on other resources from other programs that the institution is running. And this program is intending to improve access to quality and holistic palliative care for children with life-threatening illnesses, as well as their families in Africa. And it is targeting healthcare workers who are all the professionals in the different disciplines, including the medical doctors, clinical officers, nurses, therapists, counselors, social workers, police, social leaders, and also those that happen to be intending to work with children or that are working with children. And also, we are open to both Ugandans and also those that happen come from out of Uganda. And this program happened to run for one academic year because, as per the Uganda's National Council for Education Standards, being a higher diploma should not be beyond 1 year. So we ran with it one academic year. And this program, want to get onto it, you don't have to resign from your job because it's modular in nature, and they're just 4 weeks in between the 8 modules. We have the face-to-face arrangement and also online. The program modules are 8, as you can see: fundamentals of palliative care, assessment and management of clinical symptoms, palliative care, assessment and management of psychosocial issues, pain assessment and management, training and education in palliative care, research methods, management and leadership, as well as project design and management. We work closely with the Uganda Ministry of Health, African Palliative Care Association, and also the Palliative Care Association of Uganda to ensure that what we do is in line with the standards required. And the cost of the program, each module is costed at $170 only, and the total cost want to pay for the entire course is $1,380 only, and on average, one has to pay about $115 monthly to be able to raise the tuition for this 1 year academic program. We have online and also physical modules, and the applications are currently welcome, and one can apply using this link. I thank you so much.
Thank you very much, and thank you for whoever held fort while I was kicked off for a few minutes. Thank you. We shall move on to the next presenters, and that will be Dr. Boyinza from the Institute of Hospice and Palliative Care in Africa, and he will be followed by Dr. Hussein from Kenya, and then we shall hear from Kilimanjaro Christian Medical Center. That will be the sort of middle cohort. Then after that, we shall go towards the last cohort.
Thank you so much, Madam Chair. Allow me to share my slides and probably my face.
Yes, please.
Is my slide. Do you see anything from me?
Yes.
Great. Thank you so much, everybody, for your time, and special thanks to Dr. Eve for organizing this. I am going to present to you an overview of the Institute of Hospice and Palliative Care in Africa. The Institute of Hospice and Palliative Care in Africa is located in Makindye Division. It's one of the divisions in Kampala, the capital of Uganda. We are located along Mobutu Road. For reasons beyond my understanding, the road is called Mobutu. And we started training health workers in 1993 when Hospice Africa Uganda was originally incepted in Uganda. And that was a training that focused on improving the skills of health workers that were in service by that time to offer palliative care. And this was courtesy of Dr. Anne Merriman, whom I'm sure very many of the participants here know. And in 2009, the Institute was accredited as an Institute of Higher Learning by the National Council for Higher Education. That is a body that is responsible for accrediting all institutions in Uganda. And in 2014, the Institute was accredited as a degree awarding institution. And from that time on, we have moved in that direction, and we're working towards acquiring a charter. It is a one specialty institution focusing on palliative care mainly, and the majority of our diplomas and degrees are actually conferred by Makerere University. So we work in affiliation with Makerere University. And our vision is palliative care for all in need in Africa. If you hear any background noise, it is raining here in Uganda. So my apologies. And the mission is it exists as a center of excellence providing palliative care training in Uganda and all African countries, or African countries that lie within the sub-Saharan region. And our goal is to ensure the provision of quality education in palliative care through strengthening and developing a range of programs. Research is also an area that we have actually held dear, and advocacy for palliative care. How unique are we as an institution? One, we are a one specialty institution that is focusing on palliative care and with a student-centered philosophy. And our students aim to strengthen the calling of each student to care. And the majority of our students are actually not here because of the need for acquiring resources or the need for acquiring degrees, but they have the love to support and to care for those that are suffering with ailments that are chronic. And our aim is to add life to days, not just days to life. We are small, yes, to mentor, but enough to mentor and give personal attention to each student. I'm happy to note that in this meeting, we have some of our alumni, and I'm happy to see that one of them is actually a panelist, but big enough to offer palliative care training across sub-Saharan Africa. So we've had this opportunity, and we continue to offer palliative care training in sub-Saharan Africa. Our training has stretched to as far as Nigeria. We have so many alumni from Nigeria, from Botswana, Swaziland, Kenya, Sudan, name it. So we're really very proud about that. And we continue to offer the service. Our programs that are on offer currently are the Master of Science in Palliative Care, which is a 2-year program that is offered in affiliation with Makerere University. And this program is blended in nature in a way that a student will have to come to us here for 1 month in an academic year. So in the 2 years, we expect a student to come to Kampala for 2 months. That's 1 month in the first year and 1 month in the second year of 4 weeks each for face-to-face. Here we expose the students to so many aspects We expose them to the clinical service, the Center of Excellence for Palliative Care, and the research. Those are our main focus, and patient care. We introduce them to all the models of care that we have around. We have 3 postgraduate diplomas that are aimed at specializing in clinical palliative care, pediatric palliative care, and psychosocial palliative care. So if one wanted to offer a diploma program and they have a bachelor's degree, they can come for 1 year and we train them to acquire a postgraduate diploma in palliative care with the specialization of their interest. We also have a bachelor's degree that we also offer in affiliation with Makerere University, and it is 3 years. Same with the master's, blended learning. A student comes here for 4 weeks in an academic year. We have 2 semesters in an academic year, but they are only meant to come in the first semester. So the student will be able, or they have the opportunity to utilize their annual leave to study without any interruptions in their work schedules. We also have a diploma in palliative care, and that's also 1 year blended learning. And we also have a diploma in clinical palliative care, which is 1 year. But this diploma, unlike the others, is full-time. So diploma number 5 is full-time and mainly targets Ugandans. This is one of the diplomas that equips a student with the skills of prescribing morphine, managing morphine, caring for patients, and it grounds the student to be a palliative care subspecialist. What are the admission requirements? For a bachelor's degree, we admit students that have at least a diploma, either in nursing, midwifery, comprehensive nursing, clinical medicine or clinical officers, pharmacy technicians, physiotherapists, occupational therapists, and any other diploma that is deemed necessary or health related in nature. For a master's program, somebody should have a degree as a basic admission requirement before we can think of their admission. And for the masters, we have specializations in psychosocial. So that means that we are admitting students, or we admit students that have a background of social work and social administration and the social scientists. So if somebody is a social scientist, they have an opportunity to come and join our programs here. And we do teach online. After somebody has actually finished their face-to-face, we have a Moodle platform that is robust. It has almost each and everything that is required for teaching. So a student will not lack in any area. We have also short courses that we offer on request and psychiatry, and they are tailor-made to the learner. We have the allied health professionals course, the spiritual advisors course, community volunteer workers, health professionals course, traditional healers, teaching this training of trainers for trained health professionals, pain assessment and management, integration of COVID-19 into palliative care. This is a new program, but we felt it was necessary to introduce it. Palliative care initiators course, and for those that need to initiate palliative care in their respective countries or workplaces. Rapid morphine prescribers course to equip clinical officers with the skills of prescribing morphine, and the home care givers course for people who want to give palliative care in their homes or in the community. We have so many resources. We have a resource center that is rich with e-resources, e-textbooks, databases like Hinari. And for those of you that are acquainted with Hinari, it gives access to almost all databases. We have access to this. We have so many journals that we can access and materials. We have a well-equipped computer laboratory, reading space, and we have a national accredited IRB for ethical review of research studies. So it is all done here at Hospice Africa Uganda, where the Institute of Hospice and Palliative Care is actually located. We're also a member of the consortium of Ugandan universities, libraries, where access to so many e-resources is also granted. So we don't have any problems accessing resources for learning. For further details and application, somebody can contact the Academic Registrar's Office at that telephone number and email. Thank you so much for your time and opportunity.
Thank you very much, Dr. Boinza. While the next presenter is just sorting himself out, I have a quick announcement for Francophone, for French-speaking participants. Sorry about that, we didn't mention earlier. Interpretation is available on the interpretation channel. If you look at the bottom of your screen, there is a section that says interpretation. You can pick French. There is interpretation available there. Okay, please carry on to the next presenter.
Thank you.
Dr. Hussein, are you there?
Yeah, just trying to share my screen.
Yes, please carry on.
Can you see my screen?
Yes.
Right, thank you. So now my name is Dr. Hussein. Actually, I want to talk about the training and educational opportunities that we have here in Eldoret, Kenya. So one of the two programs that I want to specifically talk about, one is the Clinical Medicine and Surgery Higher Diploma in Palliative and Hospice Care. That is offered at MTRH, Moi Teaching and Referral Hospital, College of Medicine in Eldoret. And I want to also mention a little bit about the monthly palliative care echo that we conduct. It's been 2 years now that we're conducting that. And echo is actually the extension of community health outcomes. We look at it later about what it exactly means. So the higher diploma, this is the program that it's actually 1 year now in the running. It's a full-time program specifically for clinical officers, and it's an 18-month program that it's accredited actually by the Clinical Officer Council of Kenya. So it's considered as one of the subspecialties under the clinical for the clinical officers. So the philosophy of this program is to develop clinical officers in palliative and hospice care who are committed and dedicated to excellence in patient care, teaching, and research in an environment of professionalism. And the broad objective of the program is to train and produce competent palliative and hospice care clinical officers who will participate in all levels of healthcare service delivery, including inpatient, outpatient, and community-based care. So the entry requirements for this program is to be a qualified clinical officer or its equivalent. This is now students or who are coming from other countries. Have a minimum of 2 years clinical experience, be fluent in English. Fluency in Kiswahili is desirable, but if it's not there, it's okay. But you have to be fluent or show evidence of fluency in English. Be available, it's a full-time program on site, so be available full-time for 18 months. Get a release letter where applicable, and have a letter of recommendation from the employer or supervisor. So the courses, the main courses are the common courses and the core courses. So the common courses are which are done at the beginning of the program. When you begin, those are like 2 months, and they include health system management, leadership, communication, research methodology and research project, bioethics, legal, economic issues, biostatistics, teaching methodology, information communication technology, and health information system. And then now we have the core courses, which are introduction to palliative care principles, symptom management in palliative care, disease-specific needs in palliative care, and advanced practice concerns in palliative care. The mode of delivery, so this is more of like clinical and theory-based training, where you have classroom-based learning, which is self-directed learning, assignments, research, didactic lectures, interactive case studies, seminars, student presentations, computer-assisted learning tutorials, and then you have the clinical experience where now the students rotate at a national referral hospital and county stroke district hospital. So they do rotations both in the inpatient and outpatient, and they really rotate in all the disciplines where they do rotations in medicine, reviewing palliative care and hospice patients. They do rotations in surgery, obs-gyn, in the pediatrics, and then in the specialized clinics, chronic disease, heart clinic, kidney, nephrology clinics, HIV clinics. So they have this wide rotations, and with a specific of providing consultancy to palliative care patients, palliative and hospice care patients. And in addition to that, they also go and do an inpatient and outpatient hospice rotation as well. And they also do community-based palliative care exposure. And then the students also get an elective term where they go and identify their area of interest, and they spend some time trying to gain more experience and learn more about their area of interest. That's the elective term that they get as well. So the assessment of this program is there are written continuous assessment tests, end of semester exams, both written and clinical. There's a logbook they're provided with. Research project, so they have to have a thesis that they write all the way from research proposal to data collection, and then they complete, and then at the end they have to defend their thesis. So that's the dissertation. And there's practicum and clinical assessments during their regular rotations, and the institutional final exams. So the certification, upon completion, successful completion, they are given a certificate for they're given an award of a higher diploma in clinical medicine, surgery, palliative, and hospice care, which is recognized by the Clinical Officer Council of Kenya and the Ministry of Health. So these are students, once they graduate, they are actually recognized and as a subspecialist in palliative and hospice care. So it's purely for clinical officers. So currently we have our intake for next year, March 2023. And so this is just, I've taken a snapshot of the advert that was out for the students. So the fee, it's around 220,000 Kenyan shillings, which is around 2,000 USD. And there's a next year March intake. And how to apply, you can go to their website, www.mtrh.go.ke, and do an online application. You can get more details from the website and have and do an online application for that. Now I want to talk about the monthly palliative care echo. This is the palliative care echo. This is the use of a virtual platform to link various healthcare providers with specialists in a specific field. The virtual sessions are scheduled and held by specialists to provide a platform for patient case discussions, teaching, and mentoring. So this is where we meet. We have these various providers meeting with the specialists once a month, and usually ours is conducted last Monday of every month from 4 to 5 p.m. East African time. It's accredited, it's CPD accredited by the Kenya Medical Practitioners and Dentists Council, Clinical Officer Council, Nursing Council of Kenya, where you get CPD points for this. So the session is such that there's a didactic lecture where you have an expert presenting on a particular topic, and then you have a question and answer session after that, and then you have a case presentation, following which you have a case discussion where you discuss cases with the experts. So it's a good opportunity for continuous professional development, actually, to join in these sessions. So the duration is usually 1 hour, and this is the format where you have a didactic lecture, clinical case presentation and discussion, and clinical case discussion. So how to join? You can write an email to palliativeecho@ampath.or.ke and requesting to join, so you can be included in the mailing list. And then every month you get these invites, so for you that you can be able to join. So coming soon, September, we are actually at the moment working with Moi University to develop a clinical fellowship in palliative care, which will be recognized by the Kenya Medical Dentists and Practitioners and Dentists Council. This is going to be for specialists, actually for consultants who internal medicine, pediatrics, family physicians who have graduated, so they can now, if they have interest in advancing their learning and their training in palliative care, so this can be an opportunity. And so hoping that next year by September 2023, we should have our first intake. Thank you.
Thank you very much. Maybe the next presenter can just take over. Kilimanjaro Christian Medical Center, you're welcome. Is this someone representing Kilimanjaro Christian Medical Center? I don't have a name. I just have the institution. If not, we would like to, or while they are getting ready, we can just move on quickly. We have a cohort of institutions from Ghana, but maybe I would like you maybe to present all at the same time. Let's hear from Muhimbili University for Health of Health and Allied Sciences, Elvis, and we'll also hear from Center for Palliative Care in Nigeria. Then after that, we move to the cohort from Ghana, the Ghana College of Nurses and Midwives, Gladys, and then she will be followed by Ghana College of Physicians and Surgeons, and then the Royal College of Physicians in Ghana. That will be our, so this is sort of like the last group. I have requests for one or two others who would like to do a presentation as well. We shall accommodate them after this group. So first we shall hear from
Excuse me,
Elvis, we shall hear from Prof. Ajay. Yes, please.
Yes, Duncan Kwaitana from.
Yes, please.
I think I've been skipped.
Oh, sorry. From Kamuzu, yeah.
Yes.
Please, please do go ahead. So, and so we will have Elvis, please come after Duncan. Sorry about that, Duncan, and thanks for pointing that out. Elvis, please, will you come after Duncan, and then we'll have Professor Ajay.
Okay,
Duncan, please go ahead.
Okay.
Thank you so much. I hope you can see my screen.
Yes, we can.
Yes, thank you so much. So my name is Duncan Kwaitana from Kamuzu University of Health Sciences. Previously, it used to be called College of Medicine. So I'm here presenting about a Bachelor of Science in Palliative Care that we, this is a program that we have at the university. So pretty much I'll just touch on the background, the context, and the aim of the BPAC standing for Bachelor of Science in Palliative Care. The strategy program, key results and outcomes, key lessons and recommendations, and then I'll touch on conclusion. So pretty much, I think you just to remind each other that palliative care, according to the consensus definition now, is the active holistic care of individuals across all ages with serious health-related suffering due to severe illness, and especially of those near the end of life. Why we need to remind each other about this definition is that, you know, in the current era of ART and chemotherapy, the need for palliative care has not decreased. So because of that, Malawi, you know, before 2018, we did not have this palliative care course. So it meant that for healthcare workers who wanted to specialize in palliative care, they had to do so in other countries, pretty much Uganda. And I'm proud to say that I'm also an alumni from Hospice Africa Uganda. So our argument is that if Malawi has to provide quality and accessible palliative care to all in need, then human resources for health of well-trained professionals in specialized palliative care must increase. So having realized that need, Kamuzu University of Health Sciences realized that need, that specialist training outside Malawi would not immediately allow the country to reach the required numbers. As I speak to you now, at least from the 2021 Palliative Care National Report for Malawi, it shows that for those that have been trained at specialist level, we have not gone beyond 40, like 40 healthcare workers. Of course, I'm mindful that our program has graduated the first cohort, and that was 15 students. So we are talking of pretty much less than 50 specialist palliative care providers at that level. But before the program in 2015, there was a stakeholders meeting that was conducted as a process of disseminating results of a nationwide assessment of training needs. So when they conducted that training needs assessment, then it was clear that the recommendation from there was that Malawi actually needed to produce palliative care experts from a range of health disciplines. So now here we are. The program got the blessing, and it started at Kamuzu University of Health Sciences. So the Bachelor of Science in Palliative Care program at KUHES, is abbreviated, is a full-time 3-year mature entry program, and currently designed to enroll nurses and clinical officers with a minimum of a diploma. Of course, we also go ahead to say they should have at least not less than 2 years relevant experience, either in nursing or clinical medicine. And that they should also be registered with the relevant regulatory bodies. So here we're talking of the Medical Council of Malawi or the Nurses Council, the Nurses and Midwives Council of Malawi. Yeah, pretty much the fees structure, I've quoted that one for this program is 6,000 USD. When you talk in terms of Malawi Kwacha, especially for the locals, so it's like around 1,400 Malawi Kwacha. So that one is annual. So each year, a mature entry advert is floated. So the information is posted on the websites as well as disseminated through the print and social media platforms. And the applications are received through the university office. And from there, a review process for applications is undertaken pretty much as a department, because we are housed under the family medicine department. So we do the shortlisting based on the eligibility criteria. But after we've done that, the final approval of eligible candidates is made by the university board. So the key results that maybe I can share for now is that the first cohort that was enrolled in 2018 from a pool of 80 eligible candidates was enrolled in 2018. And then by 2021, we graduated a total of 15 students from this group. So these students, they graduate as a clinical associate. So clinical, that's what they are called, clinical associate palliative care. So, and they get registered by the Medical Council of Malawi. We have noted that the interest from eligible candidates has grown over time. So more people would want to enroll in this program. Yeah, here I'm just showing a picture of the 3 cohorts that we had since 2018. So we had 2018, 2019, and 2020 cohort. Of course, we now have another cohort that has come after the initial and graduated. So the key lessons and the recommendations are that I think from this, because, you know, when you are starting a thing, sometimes you're like, are we going to really manage? But at least for now, we can confidently say that specialist palliative care training in palliative care is very possible in Malawi. And that comes, University of Health Sciences has therefore provided a beacon of hope in specialist education for many Malawians, as well as for other healthcare workers in Africa. And then, as a recommendation, we are saying we should consider delivering the program. Actually, that's what we are thinking, because now being a full-time, we are thinking that we can go block release, so that we broaden the reach within and outside the country. You may have noted that I talked about 20 students that were enrolled in the first cohort, but we only managed to graduate 15. So we lost 5 on the way, pretty much because of issues of fees, school fees. So this is another area that we are focusing on: scholarship opportunities. So pretty much the global partners for care, you're here. I think you can help us. Actually, we have just cast our net wide so that we can help these needy students. So finally, what I can say is that yes, we can improve quality of life of patients, of palliative care patients, that is. So the need for well-trained professionals in specialized palliative care cannot be overemphasized. Thank you, Chair, and over.
Thank you. Let's move to the next presenter, please. Muhimbili Elvis, and then we shall hear from Professor Ajay.
Okay, can I share my
yes.
my PowerPoint?
Sure.
Let's see. Yeah, let me see. Can you see it? Hello? Hello, can you see my my presentation?
Not yet. Oh, there we go.
You can see it?
Just go to share mode.
Yeah, it has come, but make it PowerPoint.
Is it on PowerPoint? Oh,
No, not yet.
Can you see it?
Definitely.
Hello?
Yes, we can.
All right, thank you very much. Can I go on, please?
Sure.
Can you make it
So,
PowerPoint? We can continue.
From me, it's on PowerPoint. I don't know the difference. It's on PowerPoint from my point of view. I can see it from the PowerPoint of view. Should I go on?
Make it a full slideshow.
Make it a presentation. Yeah, it's a slideshow.
Full slideshow.
So that we are.
Slideshow. Okay. Slideshow. Where should I? Okay, slideshow. Oh my God. Okay, let me end first of all, maybe.
Check down on the status menu and you see something that is like an umbrella.
It's written slideshow, not so. And here?
Not yet.
Not yet.
Yeah, you were there at the bottom.
I'm at the bottom.
At the bottom of your screen. The thing that looks like a big cup or something like that.
Yes, that's where I pressed, but then it seems you won't see what I can see from here. Just a moment. That's interesting.
Okay, let's see if we can still be able to read what you're sharing, even if it is in this mode. Please carry on.
Okay, please.
Just in the interest of time.
Yeah, I think that's...
Yes, we can see what you're presenting.
Now, I'm representing Muimbiri University of Health Sciences and Allied Sciences, and actually, it's a two weeks program, and it's presented in it's a PP mode, that is. It's a private and government, approach, where the program is being held is coordinated by Muhimbiri University of Health and Allied Sciences, and is working with Palliative Care Training and Researchers Network of Tanzania. And so Muhimbiri has the facilities and the systems, and the facilitators come from palliative care trainers and researchers of Tanzania. Good. So I've just discussed this. So it's a PPP, and the course is designed to provide knowledge and skills. Correct attitudes to practice palliative care for pain management and symptoms for patients with who are terminally ill and those with limiting illnesses in Tanzania and abroad. So the course is also intended to reduce, to produce cadres, health professionals in Tanzania and abroad who are possessing the skills to practice and integrate palliative care in their health systems. And so the program started in 2019, and up to now we've had at least 114 professionals who have gone through this program. And here, there is the picture of one of the coordinators presenting the certificates to the graduates. So the course learning objectives, we expect, the graduates to have knowledge in palliative care and palliative care in general, not only in Tanzania, but also beyond, to demonstrate good attitudes and ability to handle complex palliative care needs in various situations during the provision of the health care services, provide palliative care services to patients in Tanzania and beyond. Yeah. Demonstrate knowledge of the context and variables influencing provision of palliative care in Tanzania and abroad. Demonstrate skills on how to manage pain symptoms to patients with life-threatening illnesses and limiting illnesses. Provide interdisciplinary and family involvement treatment care.
Sorry, Elvis, your slides are not moving from our end.
Yeah, for me, they are moving. I don't know what happened.
Maybe you can stop share and restart.
Okay,
and just pick up from the slide that you are on now.
Can okay. Very good. Just a moment. Can I come up with this one? Let me. Can you see anything now?
Yes, we can.
Okay.
And now it's in slideshow mode. Please carry on.
Okay, thank you very much. So I was somewhere here. So our targets are a little bit different from others. For us, we have we have taken the principle of interdisciplinary approach. We do not only have the so-called health professionals. We also have doctors, nurses, clinical officers, clinical assistants, pharmacists, assistants. We've got social workers, and we have gone beyond to include any other allied professionals and volunteers, because we feel that palliative care is an interdisciplinary approach which should involve anyone who is interested and wants to provide services in palliative care. So the patient is our center, and all our target is anyone who would be interested and have these qualifications and is able to convince us that he wants to provide palliative care. Now, when it comes to accommodation, since this training takes place at Muhimbili University of Health Science and Allied Sciences, this institution is based in Dar es Salaam, but sometimes we move to other places. But then the per diem, the travel and accommodation costs should be borne by the participants. And of course, we provide some meals when the participants are attending our classes. And yeah, so we believe that that's a motivation. The costs for Tanzanians, we've got that's about 600,000 shillings, TZ shillings. And for foreign students, we have US dollars 500. And we've got the mode of payments here. There is in Tanzania, there's what we call control system, whereby before you make any payments, since the institution is under the government, you need to have a control number that you'll be given before you make any of your payments. For those who are going to pay for the Tanzanians, and for those who are the foreign students, maybe paying from without, they are given this number from as shown on the PowerPoint. Application is also according to the systems of MUHAS. So there's a prospective parents, applicants are required to fill in the applicant's form on the university website. That is www.muhas.oc.tz. The duly filled application form, CV, and other accompanying documents should be attached. For instance, certificate, diploma, advanced diploma, and degree certificates, or above equivalent documents that may qualify you to be part of our student. And there are some important individuals that you should have to, you need to contact. From if you're going to present your application through our physical address, you have to address this to Dr. Christine V. Malichewe in the Department of Radiology and Radiotherapy, School of Medicine, MUHAS, box 65,001, Dar es Salaam, Tanzania. But then you can also use the email. We put some emails there which are lined up just there. So we try to make it as simple as possible because we want as many people as possible to join us in our palliative care training. If you may want to have some more clarifications, we have got some phone numbers there. You could call these people and they'll be ready to call you. And we have one of our cohorts that was in 2020, and we provide a certificate which has got some 6 CPD points, and these are recognized CPD points. And I just wanted to mention before I finish that this is a 2 weeks program that begins with the theory before we go into practicum, and the practicum is done in different institutions that have got the facility, and that could be hospitals or any other social welfare institutions. I would like to underline social welfare institutions, because sometimes we would base palliative care into health institutions also only, but we also go into social welfare institutions to do the practicum, especially for the psychosocial welfare, psychosocial support. Thank you. Hello, thank you.
Thank you, Professor Jai.
Yeah, good afternoon, everyone.
Good afternoon.
Good afternoon, yes. I sent in my presentation to Eve. Eve, are you there? Could you help to share it? Is it possible? I'm on my phone. Is it possible?
Let me get it to ICT to share.
Okay, thank you.
Thank you. Well, they are sorting that out. Maybe I can just remind our panelists to please check the Q&A. There are some questions that are directed to some of us, and so that we can respond, we can be ready to respond to them once the presentations are done. We are going to have a presentation also from South Africa after the Ghana cohort from the Hospice and Palliative Care Association of South Africa, after the Ghana group. Dr. Eve, is the one for Prof. Ajayi ready? If not, maybe we can give someone a chance now so that she can present afterwards while we get that presentation ready.
Someone can present as I send this through.
Okay, that's great. Okay, let's move to Ghana College of Nurses and Midwives. Gladys, you're welcome. After Gladys, we'll have the Ghana College of Physicians and Surgeons, and after that, the Royal College of Physicians in Ghana from Edwina. So Gladys, please. Okay, we can, let's hear from Ghana College of Physicians and Surgeons, since we don't seem to have the Ghana College of Nurses and Midwives. Ghana College of Physicians and Surgeons, you're welcome.
Hi, Dinah, good morning. And good morning, well, it's good afternoon, everyone from Ghana. So this is Edwina. I'm representing the Ghana College of Physicians and Surgeons and not the Royal College of Physicians. Thank you very much. I hope you can hear me though. Okay, just a minute.
Yes, we can.
Let me work on sharing my screen.
And Frank, if you can rename for us, Edwina. Looks like
All right,
Dr. Eve
okay,
is
I'll do
present.
that, sorry. And you need me to rename, just a minute. So strangely, I can't find myself to rename. I'm sorry.
Don't worry. Please carry on.
What is it appearing as? Please, can you see my screen?
As Dr. Eve. Yes, we can see your screen. Please carry on, Edwina. You're most welcome.
Okay, sorry. Let me go back. So I think thank you very much for the invitation. And I bring you greetings from Elmina, where I am attending another workshop this afternoon. So my name is Edwina Opareloko. I'm a fellow of the Ghana College of Physicians and Surgeons at the Faculty of Family Medicine, and I'm a palliative physician as well. I am one of the program coordinators for the faculty's interdisciplinary palliative medicine fellowship. So I think we are one of the youngest programs on board today. I am one of the alumni of the APCA, the Internet Hospice Africa Initiators course in 2014. So thank you very much, Hospice, for the training that you've given, and we are trying to replicate it different ways where we are. Our program is barely 3 years old. This is the third year of the fellowship program as a result of observations by several family physicians who realized that the need for palliative care had grown, considering the fact that we have now a double burden of infectious and non-communicable diseases in Ghana. So in 2012, they decided to propose that let's have a fellowship program. We had multiple palliative medicine workshops in Ghana, but none of them had led to a lasting change in practice. And it was realized that one of the deficiencies was that there was no physician leading the team and doing this full time. So we initially started with a collaboration with the International Palliative Medicine Fellowship based at San Diego Hospice that was directed by Frank Ferris and Charles von Gunten. And when that ended, we set up our own fellowship program in Ghana. We drew up the curriculum in 2018, and we started our program in our first candidate entered in 2020, so in January 2021, and we have currently 3 fellows. So the entry requirements are that you should have a membership of either the Ghana College of Physicians or West African College of Physicians or any related college in either family medicine, internal medicine, child health, anesthesia, emergency medicine, radiation, oncology, neurology, psychiatry, or obs and gynae. You must demonstrate that you've got some post-membership work experience of at least 1 year spent in a district hospital or polyclinic with a comprehensive practice or regional or teaching hospital, and you must be duly registered with the Ghana Medical and Dental Council as a specialist and be in good standing with the council. We also require that you pass a selection interview and that you should complete a diploma in projects management and design or a related research workshop at the time of the interview. Okay. So basically we want to develop a specialist who has the knowledge, skills, and attitude to work independently as a consultant in palliative, is able to manage patients with life-limiting diseases in various settings, be they ambulatory, inpatient, emergency, or at home. So first of all, you must be a medical expert who is able to apply the palliative care approach to a variety of conditions, recognize and manage symptoms, screen and manage psychological, social, and spiritual causes of suffering, and always involve the patients and their family and refer. And we also want to produce experts who are effective and educators, able to develop rapport and trust with patients and family, use a patient-centered approach, and communicate with patients and families effectively about serious illness, prognosis, goals of care, and end of life matters. Also very important, keep good and accurate written records of their interactions and to refer appropriately. They should be a good collaborator who can work and create and maintain a positive and affirmative work environment and involve patients in their own care. They should also be effective managers and leaders because we need to be as cost effective as possible. We also need to provide leadership, mentorship, and direction to whichever interdisciplinary team exists within this area, and be able to work, develop policies and procedures to direct the service. The palliative care is still quite new in Ghana. We do not have a policy that covers all that covers separately. It's found
We lost Edwina, or is it my network?
Can you hear me, please?
Yes, we can.
Okay,
Now
sorry,
you're
thank
back.
you. And then we're also developing researchers and scholars and professionals who are lifelong learners and people of integrity. So what's the program content? We cover all these areas. This knowledge here, we emphasize the personal qualities and behaviors of palliative medicine, physician skills, physical care, decision-making and clinical reasoning, disease process and management, pain and symptom management, how to manage emergencies in palliative medicine, therapeutics and safe prescribing, psychosocial care, emphasis on understanding patients' culture, language, and religion and spirituality, teamwork, teaching and training, and research. It's a 3-year program, which is with the emphasis on the clinical work because it's a fellowship. So we have block rotations which go across the year, and then we have longitudinal activities. So for the block rotations in the first year, first thing you do is palliative medicine and pharmacology, which is about 8 weeks. And then you spend time in adult oncology, child oncology, also geriatrics, at the sickle cell clinic, HIV, gastroenterology, neurology. You also do some palliative oncology. You do an anesthesia rotation, and then we make time for conferences, update courses, and the leave. Longitudinally, we are still family physicians primarily. That's we have so far the only family physicians in the program, even though it's open to others. So we still want to keep them abreast with what their primary specialty does. So they spend at least 1 day in the clinic, and they spend time on call on research activities. And in the first year, the main research activity is to write their research proposal for their dissertation, which is part of the requirements of the Ghana College of Physicians and Surgeons Fellowship Program. In the second year, we try to do pediatric palliative medicine. Now we do not have, Ghana just recently got their first pediatric palliative physician, and she just returned. So we've been with pediatric palliative medicine, we've been working closely with Professor Renner and myself to tutor them in pediatric palliative medicine. They also do palliative care and surgery and other specialties, and then they have to do health administration and management. Since we are a new program and we do not have inpatients palliative care built up, we do not have hospices, then an elective is an important part of our program. We are yet to do that. We are still looking for partner facilities for that, where residents could spend anything between 3 and 12 months to boost their confidence with certain things, especially in inpatient care. And in the third year, they rotate through the other specialties, so nephrology, emergency medicine, respiratory medicine, rheumatology, rehabilitation. Then they focus on acute inpatient palliative care and spend the rest of the time in palliative medicine and prepare for their exam, which will entail theory exam, which is an MCQ, and then they also have an oral exam and defense.
Edwina, if you could please round off.
Yeah, that's the last slide. So our training sites are Kolebu Teaching Hospital, Komfo Teaching Hospital. For the Ghanaian residents, it costs, as at this academic year, 7,500 Ghana cedis a year, not counting any other costs. I'm not too sure exactly how much it costs for international residents. It's a little higher than that. Well, thank you very much for the opportunity.
Thank you, Prof. Ajay. I think your presentation is ready now.
Hello, good afternoon. Yeah, good afternoon, everyone.
Good
Can you hear
afternoon.
me? Yes, thank you.
Yes,
And
we can.
sorry for getting our presentation out late. Yeah, I greet all and I appreciate all our institutions that have presented and those here to present for all the good work they're doing to establish palliative care and also to ensure that we have training and also make it academic position. This is actually what we here in Nigeria, Ibadan specifically, the Center for Palliative Care, we are also passionate about getting the training of palliative care done at different levels and cadres of professionals that will be involved in palliative care. Can we change my slide, please? Can we move the slide? The next slide, please. Okay. So the Center for Palliative Care Nigeria is a non-governmental and not-for-profit sharing organization, which was founded in 2002, and we got registered in 2005, and we have a board of trustees. Currently, it is in it's station. I mean, it's based at the Institute for Advanced Medical Research and Training in the College of Medicine, UCH, and we collaborate with different health institutions in the country to create awareness, provide training, and establish palliative care units. In addition, we offer palliative care training to health professionals of different cadres, and we also provide support and care for patients. And this is being done in collaboration with the University College Hospital, Ibadan. And we helped the University College Hospital, Ibadan to develop the first hospice and palliative care unit in Nigeria, which is now in this hospital. And that's where we carry out most of our services, care services and support services. And many of our trainings are also conducted in the hospice and palliative care, aside the ones that we also organize differently. And the people that we focus on are physicians, nurses, pharmacists, social workers, carers, physiotherapists, and other health-related disciplines that are interested in palliative care. The next slide, please. Now, we have prepared a table. Let me mention that with me on this presentation is one of our very top nurses who is really anchoring the palliative care program in the University College Hospital, and that is Mrs. Adegboye. She's with us on this program. So we have these courses we are doing now. We are not fully academic now, although we are in the process. So we focus more on the cadres of professionals who can provide support, care, and also who can again graduate and move on to academics. So one of the courses we do is the palliative care startup training. This is like an introductory course for people, for healthcare professionals. And this usually is for 3 days, and we conduct workshop on site. And the mode of delivery is we have the didactic lectures, we have group work, we have role plays. And for someone to qualify for that training, they should be a health professional. And it can also be, we also have, at times we bring in some administrators so that they also have a basics of palliative care so that they can buy into the program and send more of their professionals for training. And the participants are expected to have at least their basic professional certificate. And so it could be RN nursing, MBBS, and so on. And the charges, I would say, is not fixed. And the one we had, the last we had about, sorry, this is small form, okay, about $625 per person to run that course. Another course that we run is the carers course. And this is to build up capacity for people who will be helping with home-based care, which we offer. And these carers course, depending on the type and the level, runs 3 days to 1 week. And again, it's on-site. It's in form of training workshop. We have lectures, practical demonstrations, and group work, as well as role plays. And the people that are eligible, these are individuals who have interest in palliative care, and they could be like health assistants, retired health workers, and people who care for the aged in the community, and even young graduates who may want to have some things to do while waiting to get admitted into other institutions. Then we have organizations who are carers, and they may send their words to us so that we can train them and they can be better carers for the organization. And for these people, there isn't much in terms of entry requirements. The secondary school education and above. So just to be able to, they have the interest and be able to learn easily. And for this, we charge about 50,000, which is about 300 USD. For palliative care sensitization, this is a one-day program that we offer to stakeholders, especially community stakeholders, when we want to create awareness and sensitize them so that we can get people to be interested in palliative care and those who can actually become care providers or carers. So we do this for leaders in institutions, in communities, and including market women, age group leaders, and so on, just to let them know there's this palliative care service and how they can play a role in it. So most times they are nominated by their members, and it is free for this group of stakeholders. The next slide, please. Next slide. So, sorry, before this, there's a slide 2 on courses available. There's a slide 2 before this. No? Before this one, there's another slide. Number 2, this is 3. Slide 2. Okay. Now, these ones are more specific and their health professionals course. This is for 2 weeks, and again is a form of training workshop on site. And we have lectures and so on, including clinical placements. And those eligible are health professionals such as doctors, nurses, psychologists, pharmacists, physiotherapists, and social worker. And again, the entry requirement is their basic professional certificates. And the fees for this could be up to like 150,000 naira. Like we said, we started with smaller amounts, but things are getting more and more expensive. So the costs too are going up. Then we have the palliative care initiators course. And this one is for 5 weeks. Again, is on site, and those eligible are still health professionals. And the the entry requirement is a basic professional certificate. And this is a bit more expensive. We have like 290,000 naira, and this is about 1,000 USD. But like we said, some of this may be subsidized. It could be the institutions that will send them and sponsor them for this course. The next slide, please. Now we have stepped up, and we have started the process of having an academic course for palliative care in the University of Ibadan. And the process is in the advanced stage. We started from the department where we plan to this to be domiciled, which will be the anesthesia department. And it has gone up to the postgraduate school. But with the strike, COVID, this has caused a lot of delay for the final approval. What we are proposing is to have a diploma course, which will be 1 year, and then we have a master's program, which will be 2 years. The mode of
if you can round off.
Yes, the mode of delivery is that of the just as every other university program, and eligibility would be individuals with the basic degree in which we're looking at. For the diploma, people should have the school cert and also have a degree in maybe pharmacy and all those things. And also the same thing for masters. But for masters, we have a minimum of second class lower that we shall be entertaining. And the fees are yet to be determined. The next one, please. So this one, I'm not going to talk much. It's just to tell us example of the objectives of each of the courses and the benefits, which you can read later. Can we move on, please? So these are some of the topics in our curriculum. We cannot share the curriculum now because it's still under review. The postgraduate school will still look at it, so we cannot really bring out it. But for the other courses, the professional courses, certificate courses, these are some of the topics that we bring up and teach. So we have introduction, principles, models, and looking at the different diseases that may require palliative care, communication, ethical issues. Can we move on? Please, the next slide. And cultural things, spirituality, all those things that are basics to palliative care are what we teach. Can we move on, please? So thank you very much for listening, and we will be available for your questions. Thank you.
Thank you very much, Prof. Now, if we can just hear, we are going to address some of the questions that have been asked, and there's quite a good number. We've tried to group them up also and see if we can get responses from all our panelists. But let's hear from the last presenter, which is going to be Leon O'Haley from the Hospice and Palliative Care of South Africa. Leon?
Good afternoon, everyone, and thank you so much for this opportunity. Just to say that I am going to be presenting on behalf of our CEO at the Hospice Palliative Care of South Africa, Dr. Eva Skaronska. Unfortunately, she was called away. I'm just going to share my screen. We have a very short presentation on the courses that we have that we provide. Please tell me when you see something.
We can see your screen, but you just need to select the right page.
Right, exactly. Let's go quickly. I do apologize for this. In the meantime, I can tell you that the Hospice Palliative Care Association of South Africa has been providing short courses since the 1980s. And we're very pleased to be able to continue to do so. I'm so used to working on two screens, and now down to one screen is causing anxiety. Let me just go directly to the PowerPoints. Can you see the screen?
Yes.
Okay, so as mentioned, we've been providing palliative care short courses since the 1980s. And then in 2016, we definitely saw the need to move courses online. And we're very grateful for that when we encountered the pandemic. So the courses, just a quick overview of courses that we run in South Africa. And basically, it's too many cadres of healthcare workers from professional staff, including home-based carers, etc. And it's been wonderful to see all the work that's been done in all the different countries across Africa and some of the similarities. So we have an introduction to palliative care for professionals, which is a 40-hour course, which we run both face-to-face and online. It has CPD points with the Health Professionals Council of South Africa, 30 CPD points, and it's also run and it has been accredited by the University of Cape Town. The certificate course in palliative nursing is run over 10 months and is specifically for enrolled and professional nurses and has been run since the 1980s. It's accredited by UCT as a short course, and it's offered both face-to-face and via e-learning. And this is particularly helpful in our more rural areas where it would be difficult for students to come into lectures. And it's proved to be a very good format for running the course. We also have a course specifically for psychosocial staff. So we're mainly looking at social workers, psychologists, spiritual counselors working in palliative care. This is a short course and it's also portfolio driven. And just recently, we have also made this course available online, and it holds 18 CPD points with the South African Council for Social Services Professionals, which is very favorable to them as they need 25 CPD points for the year. Another area that we have developed a course in is for the first time ever in South Africa, there is now a qualification for home-based carers through the South African Qualifications Authority, which was not the case previously. It was people offering home-based care training ad hoc. So this is now seen as a full qualification. There's two different courses. The one is a 6-month course at NQF level 2, and the second one is a NQF level 3 course, which is an 11-month course, which includes a module on palliative care as well. And it's the first time that home-based care carers can be qualified in palliative care, and the first exams were written in February this year, and we've developed the first cohort of home-based carers who are now qualified through SAQA, which meets the international standards. And then for our carers that have been working and are working in the field but have not had a palliative care component, we have a 40-hour face-to-face course which is available for them. So mainly we're looking at enrolled nursing assistants, caregivers, and a number of auxiliary social workers also attend this course. And we have just obtained 19 CPD points from the South African Council for Social Services professionals for the auxiliary social workers who opt to do this course. And then if we just look at which courses, so those obviously are courses that are all available to people living within South Africa and having access to the face-to-face courses. And then we have 2 online courses at the moment, which are available to people who live outside the borders of South Africa. So that would be the Introduction to Palliative Care for the professionals, as mentioned before, as well as the psychosocial course, which is a sort of more in-depth course to do for the psychosocial professionals preferably after they've done the Introduction to Palliative Care course, but it's not an essential component. The next couple of slides are really just the flyers for these 2 particular courses which are available online. The writing is relatively small, so I think it would be best if I just popped in the chat our website address where you would be able to obtain these flyers should you should you be interested, and you can email us. And I'd just like to thank you on behalf of the Hospice Palliative Care Association in South Africa.
Thank you very much, Leonor, and thank you to all our presenters this afternoon. We have pretty much run over time, but there were some questions that needed some responses, and I'm not sure if people are willing to extend by another few minutes so that we can just get some responses from the panelists on the issues that have been raised. Can we extend for another 5 minutes or so, Dr. Eve, panelists and participants? Is that all right? Just so that we can at least address some of those issues raised. Maybe you can also draw your attention to the online registration where you can register your palliative care courses. That was shared by Catherine Peters, and I think somebody else, a colleague again from IHPC, who shared it as well. Please let's access that link. It's in the chat and in the Q&A as well. Okay, Dr. Eve, let me hand over to you and to the panelists so that we can hear from responses, maybe just another 5 minutes or so that we can respond to some of the pertinent issues that have been mentioned in the Q&A. You can just pop up if you need to respond to a question that has been addressed to you.
Maybe I can read the first question for Renee. Is the MPhil also for the multidisciplinary team? I know we have palliative medicine and palliative care, so people would like to know if members of the multidisciplinary team can also apply.
Definitely, and we welcome them to apply. and we make sure that any advanced palliative care will then have advanced psychosocial care or advanced nursing care, etc. So definitely the MPhil is open to a wide variety of disciplines, and we welcome these disciplines to join the MPhil program.
Thank you. And then we have another question from Catherine, IHPC. How much demand is it that we have which cannot be met by travel or cost?
So thank you for that question. I did reply in the chat, but one of the main problems are really people who are traveling from rural areas and from disciplines like social work and nursing, where they don't get huge salaries. I do think there's a massive need to have scholarships available for these disciplines, and especially in rural areas where whether it's doctors, nurses, or social workers, or even spiritual counselors who require to be in Cape Town, they can't afford to come here. So we really would need to think very carefully and strategically how we can support these disciplines in reaching their financial needs so that they can actually come and do the courses. And especially it's in these areas, especially in rural areas, where we really need the palliative care to be available.
Nasul, are you also able to respond to that? Dr. Nasul Wiinza?
Hello.
How much demand do we have which cannot be met? Which cannot be met due to cost or travel?
This in regard to the students, it's not very clear to me.
Okay, say if 20 potential scholars apply, how many fail to get to enroll because of affordability or inability to travel?
For our programs, it stands at around 50%. So about 50% of the applicants that are admitted for the different programs here actually don't turn up. And the main reason is because of scholarships and lack of funding and things to do with that.
Okay, thank you. And then Duncan?
Yes, thank you. I had also responded. However, just as Nasuru has said, for us, yes, about 50% cannot meet their tuition fees because majority of them are self-sponsored. But also, apart from the tuition, we have 3 clinical placements where the students go to districts, like district rotations, where they have to find their own accommodation and even travel. So that is also like an extra cost for the students, bearing in mind that they are already, because they are not resident at the institution, so they find their own accommodation. So when you send them for clinical placement, that would also be an extra cost for them. Thank you.
Thank you very much. Any other person who would like to comment, a panelist? And then I have another question. How do you partner with business educators? Our colleagues in Ghana, do you partner with business educators?
So then the question would be, I'm trying to figure out who business educators are, because I haven't come across them in Ghana.
David Kavuma, do you partner with business educators?
Business educators, it's not a very clear question to me. What exactly is that going to? It's like other programs outside the palliative care? Is that the kind of question? Not so straight to me.
Yes, you could even be subcontracted by, say, the military to go and run courses on palliative care if they've recognized need.
We have happened to work with the other institutions that are outside health. Like I would say, we work like with the URA, for example. Of course, on short, you gotta have information like on short courses, for example. That's what I can say. But though even the other that happen to be outside the health can come and attend our programs. Hope that is sufficient.
Yes, thank you very much, David.
So, if you're asking about in terms of business educators working with other groups who want to promote palliative care education in facilities, etc., yes. When there's such a partnership, we will work with them.
I think we've lost Eve again. So perhaps we can, but Sarah, do you want to ask the next question?
Yes, I also dropped out a bit, but there's a question that says, if I have a degree in nursing and would like to change I guess it's to palliative. They are saying, what would you recommend, palliative nursing or palliative medicine? And what are the answers? Sorry, and what are the requirements?
So it depends it depends in each country, and it's very important to link with your professional body to see how you will be registered. So if you want to decide what you want to do, palliative medicine is just, so we've got degrees specifically for nurses and degrees specifically for doctors, but it will be important how you, if you are a nurse, to see how you can link with a nursing program and how you will be registered afterwards with that program. So in your own country, go and speak to find out from your nursing council how you want to, what courses they will recognize and what courses they will register your name under.
Mm-hmm.
Yes, thank you so much, Ruby. That goes back to what I said previously, that what passion do you have as a potential student? Don't just go in because somebody has pushed you to go in for a program. You must, first of all, have the passion to do that. Otherwise, we will end up training people that are not going to be helpful in the field. Thank you.
Thank you. And then there's a question that's saying, are the programs officially acknowledged by government for the practice of palliative care? Probably that might be country specific, but yeah, there is a question that's asking if somebody's qualification in palliative care will be recognized.
Okay, so can I answer for Ghana?
Yes,
yeah, so yes, Ghana, once you get the fellowship in palliative medicine is considered an additional qualification, and you would receive a promotion based on that. For the nurses in the Ghana College of Nurses and Midwives Palliative Care program, they undergo a 3-year program and come out as members of the Ghana College of Nurses and midwives and are considered palliative care nurse specialists. So they are like nurse practitioners and are able to practice in collaboration with other physicians in their various settings. So that's also recognized by the Ghana Nurses and Midwifery Council and by the government. So that's what I know for us in Ghana. When you have the Palliative Care Initiators certificate from Hospice Africa Uganda, you're also able to practice within your setting. However, it may not come, that does not come with the promotion, but it is recognized by the nurses. Thank you.
Can I say something?
Yes, please.
Thank you so much, Chair. Yes, in Uganda, we have the National Council for Higher Education. This happened to graduate higher learning education. And in Uganda, you can't run a degree or diploma program without being accredited by the Uganda National Council for Education. For us at Maldive Institute, our program is free accredited, and every after 5 years, we review it and we submit National Council as per the standards to ensure that the program is relevant to the prevailing needs. Thank you.
Thank you. There is also a post from Elvis that says, for those who would be interested in Palliative Care Works UK for short films.
My hand is
yes,
up,
Prof.
Prof.
Yes, Prof. Okay, let me just finish reading this one,
Okay.
then you can give your contribution. Thank you. Those who would be interested in Palliative Care Works UK for short films on basic palliative care training, please refer to Palliative Care Works UK link. So there's just an announcement from Elvis. Yes, Professor Ajay.
Yeah, thank you very much. I just want to speak for Nigeria concerning the use of certificates in palliative care. The certificates that we get from Uganda, the ones we now issue out for the various professions at different cadres, those ones are recognized at the hospitals, and people can be posted to units that are offering palliative care. But really, its certificates, it may be considered for posting, but for promotion, the other basic requirements are still needed. But now that we are considering academic palliative care departments, this one will be very useful for people who want to pursue academic career in palliative care. So it can be used as an entry requirement and also for promotion from the lecturer 2 to 1, 1 to 2, 2 to 1, 1 to senior, depending on whether the person pursues it as high as a PhD. So it would be considered at that level, at the academic level. Thank you.
Thank you, Prof. Any other panel, questions that have been raised to the panelists that you might want to respond to? We need to be rounding off now. Panelists?
Can I come in, please?
Yes, please.
Yeah, just a great concern. You see, we have this, SDGs where we should not leave our patients behind. Now, if we are going to review our training in palliative care, whereby we have to be very careful. If palliative care training will be there just to curtail some of the people, not to provide the palliative care. I think we have to tailor our training to ensure that we have as many people as possible who could provide palliative care, so that as many patients and families could have access to palliative care. So if we will, based on looking at how we'll be promoted, how we're going to have higher education, I think palliative care should not go in that direction. Thank you.
Thank you for that, Elvis. A lot of the questions the panelists have tried to respond also in the chat and also in the Q&A. So if you check your question and maybe we have not addressed it here, you might find that they have responded to it in the Q&A. They've written back to you. There's another question that's asking about, are there scholarships to assist? I think that question has been answered now. There was also another question that was asking if they can have a written handout of all the programs presented today and the contact details. I think this is where Dr. Eve and the other partners are taking this so that we have a database of all the different institutions represented here that is comprehensive, that covers all the courses that are offered and all the details that were shared today. Just checking, so Dr. Eve has not been able to get back. Are there any other final questions or inputs before we call it a day? Okay, thank you very much. If you can give me just a second, let me see if Eve is still trying to get on board. Otherwise, we have come to the end of the session. Let me just quickly see if she's still trying to get on board. Okay, so thank you very much to all our panelists and thank you to all our participants. I believe a lot of information has been exchanged. I believe that a lot of also collaborations can take place between our institutions. It's not just for the awareness of the prospective students, but also amongst ourselves. We need not spread ourselves thinly, trying to reach everywhere. We can, support each other where we have different bits of work happening. There's been good representation from all regions of the continent. We have good presence in East Africa, good presence in West Africa, good presence in Southern Africa. So I believe that that will enable quite a lot of collaboration and partnerships to also be forged ahead. Joint advocacy initiatives also, where we need to push for change and where we need to push for more visibility for palliative care. So thank you very much to everyone who has taken their time to be here today. Our session has come to an end.
Bye-bye.
Thank you very much, APCA. Thank you, and Global Health.
Thank you, everyone, and goodbye.
Bye.
Thank you.
Bye.
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 Bye. Bye. Bye.
Thank you.
Bye.
Goodbye.
Bye. Bye.
Bye.
Asante. Bye. Bye.
Bye.
Asante.